When you are discharged from the hospital, your family can have a car waiting for you. The doctor will advise you not to drive for 4 to 6 weeks after surgery. You'll be able to get into the car by yourself, and it is important to protect your breastbone as you are seated and make sure your seatbelt is comfortable and secure. If you have any long distances to travel by car, you'll want to stop and walk around for a few minutes every 45 to 60 minutes. It will feel good to be home. In the first few days, you won't feel like doing too much, but it's very important to get up and move around. There are 3 major considerations for healing and recovery after surgery: breastbone precautions, healing of your incision, and progression of your activity. While your breastbone is healing, it will be important not to lift, push, or pull anything heavier than 5 to 10 pounds for 6 weeks. The most you should lift is equivalent to a gallon of milk. Try to use your arms together as much as possible, especially when reaching for objects above your head. Avoid strenuous activities like vacuuming, mopping, heavy yard work, or anything that requires vigorous use of your arms. You should look at your incision daily, and it's important to always wash your hands before touching this area. As it heals, the redness and swelling will decrease. Daily showers are recommended for about 6 weeks. It is helpful to have a family member there to help you as needed. You can wash your incision with mild soap and water and gently pat dry. You should not apply lotions, oils, or vitamin E or antibiotic creams unless directed by your doctor. As your incision is completely healed, you can use moisturizing cream or baby oil for itching. It is very important to call your doctor for any signs of infection, such as increased drainage or pus, increased swelling, and increased redness or pain. Getting out of bed those first few days can create a little anxiety. Someone can assist, but they should not pull on your arms. It is vital to gradually increase your activity to prevent complications. Walking helps you to gain strength and helps your lungs to clear. Start with 2 to 3 short daily walks and walk at a comfortable pace, which will allow you to talk without feeling or sounding breathless. Keep track of the number of minutes you walk each time and add a minute or more every day as long as you feel good. Gradually build up to a 40 to 45-minute walk if possible. If you have any symptoms such as shortness of breath, dizziness, lightheadedness, a fast heart rate, cold sweats, or excessive fatigue, you should stop, rest, and return home. In the first few days at home, you may be anxious about your recovery. You can be left home alone for short periods of time. You may experience common problems such as decreased appetite, nausea, slower bowel activity, or sweating during the night. Some people experience insomnia, an inability to concentrate, or bad dreams. You may experience emotional and physical ups and downs, and it is helpful to share these feelings. You should wait a few weeks before resuming any sexual activity. When you resume sexual activity, be careful to protect your breastbone. In addition to your activity at home, you may want to join an outpatient cardiac rehab program. Talk with your doctor about this option and any other questions you may have about your recovery. You will have a follow-up appointment with your surgeon about a month after you go home from the hospital. Since it takes about 3 months for the breastbone to completely heal, this is the time to ask when you can resume more strenuous activity. Notify your doctor if you have any drainage, increased tenderness, redness, or swelling in your incision. A temperature of 100 degrees or higher. Breastbone popping, clicking, or movement. Nausea, vomiting, diarrhea, or constipation. Weight gain of 3 pounds or more in a 24-hour period. Any angina or heart discomfort other than incisional pain. Persistent or increased swelling in your feet and/or lower legs. Having open heart surgery is a big challenge in a person's life. The road to recovery is hard work, and with help and support, you'll make steady progress at getting back to a healthy life.